Hi, I'm Dr Lorraine Hill from Hampton Clinic in Solihull. I'd like to go into a little bit more detail today about a Zido 3-step peel. Now our skin is made up of layers and the top layers are usually where the damage is. So a skin peel can remove these top layers of skin, and the deeper we go into the skin, the better the quality of the skin is. So we can tailor our peels according to your problems and dictate how deep our peels are going to go and how many layers of damaged skin we're going to remove. So with a 3-step peel, it's a cocktail of three different acids. We have 5% lactic acid, 17% salicylic acid, and 10% trichloroacetic acid. So the lactic acid works by dissolving the bonds between our cells on the surface. So the epithelial cells, they all let go of each other, so they're much easier to flake off. Then the salicylic acid comes in and dissolves the actual capsule of the cell. So it's dissolving the cell and removing the cells that way. And then we have our trichloroacetic acid that's going to go deeper. It goes deep into the epidermis, and depending on how much we put in, it might even go as far as the dermis with certain peels. So this particular cocktail of peels that we apply with a 3-step peel is going to be brilliant if you've got acne problems, scarring, pigmentation issues, and textural problems. The 3-step peel is a strong peel, and it does require careful supervision with your Zido skin health provider and adequate preparation. It's absolutely essential that you're on a good skincare regime that includes a strong retinol for at least 4 to 6 weeks prior to the peel. 1 week before the peel, we recommend that you avoid all things like waxing, laser hair removal, any dilapidatory creams. We also say it's essential that your skin is fully recovered from any previous treatments that you might have had, from such as IPL or any laser treatments. 3 to 4 days before your peel, we're going to tell you to stop any irritating products. So any retinols that you're on in your normal skincare regime, or anything that contains any of the alpha hydroxy acids, beta hydroxy acids. So things like your oil control pads and toners, extra exfoliating creams, that are slightly irritating or harsh. We've got to stop all of those 3 or 4 days prior to the peel so we don't get too much reaction from the peel. So this is our 3-step peel kit. It's a very simple peel. What we're going to do is start with simply cleansing your face. Then we're going to use some alcohol to degrease your skin, so we're going to get maximum penetration of our cocktail of acids. So this is the kit of the 3-step peel kit. It contains our peel solution, it contains some retinol, and then our hydrating cream. So initially we're going to use the whole vial of our peel solution. It might feel uncomfortable, it might feel hot, stinging, burning. We can use a fan to help keep your skin nice and cool during the treatment. And we'll just very slowly layer on with a cotton pad all over the face, nice and evenly, the whole of this vial until it's all gone. So that's the peel that's going to strip down the layers of dead and damaged skin. After that, we're going to use our retinol complex. Now, this is the stimulating part of the peel. The retinol is 6%, it's really strong. So for a home skincare regime, you're never going to have anything more than a 1% retinol cream. So with our 6% retinol cream, having stripped back layers of the epidermis, this is going to allow this retinol to penetrate very deeply, right down to the junction where your epidermis meets your dermis, where we have our fibroblasts that are going to make all our collagen, our elastin, and all the nutrition our skin needs. And making all the new epidermal cells. So 6% retinol is our dermal stimulation and is going to really wake up our cells, making new and healthy skin. So after our treatment, which is literally going to take us 10 or 15 minutes, You'll then go home, and we would recommend that you don't do anything for the rest of the day. You don't even need to wash your face that night. You've obviously had a thorough cleansing during the treatment. The following morning, you will go home with a second sachet of retinol, your 6% retinol cream complex. So we'd say put this on the following morning, all over the face, equally over the face, and just let that soak in. After that, you can start using your hydrating cream. So the hydrating cream is, as it says, it's hydrating. It's like a moisturising cream, but rather than forming a barrier on the surface of the skin, it's going to penetrate deeply into the skin, really hydrating all the layers, making your skin more comfortable and feeling less dry. For the week following your treatment, you're going to expect to start seeing some peeling and almost like scabbing, darkening of the skin as the skin starts to die and come away. And this is going to start probably about day 2, day 3, and can go on for between 5 and 7 days. It's absolutely critical that you keep out of direct sun exposure. We don't want you to do any picking, rubbing, peeling of any of the dead skin. It's got to come away naturally, and if you do have a lot of excess skin, we would say get a pair of scissors and just snip away at any flaky bits of skin. If you pick at the skin, peel the skin, you are going to risk pigmentation. It's a powerful peel, and if you don't follow the instructions carefully, there will be risks of complications, one of which would be pigmentation from picking and peeling. Also, if you were to get sun exposure on the new and vulnerable skin that's just been exposed, that again is going to risk severe burning and possible pigmentation. So if you have got a large area that the skin has come away, you can start dabbing on a little bit of SPF on those areas. We don't recommend SPF until the skin has come away, so we'll usually say put SPF on once the peel is complete. But I did have one lady, she had gone out in her glass topped mini, and sun exposure just through the light burnt the areas where the skin had come away. So if you have got large areas that are exposed, you can dab on a little bit of SPF in those exposed areas. But what we don't want is you to be rubbing on SPF all over and over the dead skin that hasn't come away yet, because you're going to be rubbing that skin and pulling it away prematurely. A few other recommendations post-treatment. When you have a shower, we say don't blast water on your face. You can wash your face with a gentle cleanser, and we'll say just very gently wash and pat dry. So you can use your hydrating cream as frequently as you like. And by day 7, when all your skin has come away, you're going to have this lovely, fresh, new baby glowing skin. So once all your peeling is complete, you're then going to go back to your normal daily skincare regime. Thank you.